Moving on to the next panelist, we are lucky to have him here, the VP of Operations from Sims, the place that I know all of us wish we had Proforms at. Representing today, Ben. We have Ben Christensen from Sims. Thank you for joining us, Ben.
Yeah, you bet. Happy to be here.
So this is a fascinating story and has made nationwide news pretty quick. And I'm just so grateful that you were able to join us here today to talk about the pivot, that famous word that businesses have to make when times get interesting. But Sims had a moment of pivot, and maybe I'll let you take it from there and talk about how you guys have risen to the occasion.
Yeah, you bet. So we, in conversation with Bozeman Health, the hospital in Bozeman, realized that they, like many hospitals in the country, were anticipating a severe shortage of PPE, protective equipment for their healthcare professionals. And right about that same time, we were anticipating a pretty severe slowdown in our business and a government mandated shutdown of our waiter production. And the stars really aligned. We saw an opportunity to take our capabilities of making really technical, really durable outerwear and pivot those capabilities to support our local healthcare system in their time of need. So we started with Bozeman, partnered very closely with their team to create a gown that satisfied their functional requirements and utilized materials and capabilities that we had on hand. And with that proof of concept, we were able to produce, I think about 350 gowns for Bozeman Health. We are now producing gowns for Billings Clinic, for the Sydney Health Group, for the Mariah's Health Systems in Shelby, and really doing everything we can to support the community here in Montana, first and foremost, and see where it goes from there.
Oh, that's excellent. As you hear about all this stuff being used up so quickly, two things come to mind. Obviously, the safety of our medical professionals, but also just the waste of how much of this stuff's getting thrown away. So what makes a gown reusable versus what's being thrown out?
Yeah, a lot of the protective equipment is just single-use disposable. So certainly surgical masks, other types of face masks, and gowns as well, particularly for less protective, what are called level 1, level 2 isolation gowns. Our gowns are just kind of by definition reusable because that's the only way we know how to manufacture product, and those are the types of materials that we use in manufacturing. So we're using technical, waterproof, breathable fabrics similar to what you'd find in a really nice ski shell or any sort of outerwear. And those materials are designed to perform over many wash cycles over a long period of time. Oh, and so just kind of by design and because of the nature of the materials, these are reusable products.
Wow. So you've already gone past the Bozeman market. You said you're working with a couple other health groups. Is this something that you see further expansion on? And do you see this as something maybe is in a permanent product line moving forward?
Certainly something we hope to expand on. We were cautious about broadcasting our efforts until we had really delivered product to our hospital in Bozeman. But on Friday, we made the first delivery, and Bozeman Health wanted to tell the story a little bit. We put something up on our Instagram feed, and we had, I think, over 1,000 comments within the first 24 hours. Many comments from people who are in the healthcare industry who are looking for protective gowns. And this morning, we were just inundated with requests to get gowns from Sims. So we are rapidly building out the operational capabilities to efficiently meet all of these demands. I have a theory, which may prove itself out, that smaller clinics, smaller healthcare systems are going to be most underserved as these PPE manufacturers ramp up. I expect that the big manufacturers will target big buyers, big hospital systems. And so I'm hopeful that Sims can build capabilities that enable us to ship 1 gown, 5 gowns, 50 gowns, whatever's needed out there. So that was my day to day, was just figuring out how we take all of this energy and turn it into as much impact as Sims can have on this problem.
Well, that's great. And I think when the dust settles, it'll be interesting to think about the amount of waste that was created, not waste, but disposable. And I think what 1 gallon maybe represents, that's a pretty, very impressive. Um, you guys are a cornerstone of the Gallatin Valley, and I will say that we're very proud to have Sims be in our backyard. Great company, represents great brands and great people that work there. How did you guys take this crisis and pandemic, and I mean, how are you guys doing as a company outside of this gown manufacturing, and how are you guys looking to to move forward as we come into your season, into the spring and summer?
Yeah, you bet. Most simply, we are preparing for the worst and hoping for the best. We saw the impacts of this first on the supply side. We manufacture a lot of product in Bozeman, but we also source a lot of product from overseas. And so we had the early impact of supply chain disruption in Asia. And of course, pretty quickly saw that impact cross borders and start to impact the economies in Europe and the United States, and very quickly became a demand issue for us, and I think for all consumer brands. Taylor hit on it earlier. Cash is king in a time like this, and so we are just sitting down thinking about the things that we really need to invest in right now to ensure that the momentum that we have as a brand continues through this, and that as we recover quickly. But we're being cautious and we're pulling back a little bit in terms of some of the investments that we had planned. Just trying to shift more and more focus to some of the things that have already been brought up here in terms of how the coronavirus is impacting people's mental health, and really thinking hard about how our employees are transitioning to a work from home environment, making sure that they feel informed and supported. So that's a big part of it as well.
Excellent. Well, that's great to hear. Before I turn over to Joe, I think, my last question is for all the Sims fans out there, or especially Sims fans that are doctors. Can you get your hands on these gowns? And also, is there a way that as a community or foundations, are you guys looking for support? Are there ways that if there was a philanthropic person watching this that maybe wanted to buy some of these to donate them to a hospital or one of those small, medical practices that's in an underserved area, is there opportunity to do something like that?
Yes, yeah, definitely. All of that's possible. So we've created an email address, medicalgowns@simsfishing.com. It's just a kind of a catch-all for all of these inquiries. We are, as I mentioned earlier, building the capabilities to ship single gowns or just a couple of gowns to folks that need them. And we've seen a lot of interest in that. At this point in time, the capacity that we have is really fully consumed this week, but we're hopeful that by next week, we'll be in a position to fulfill more and more of those needs. In terms of philanthropic partners, we are absolutely interested in engaging in those conversations. Some of our fabric vendors, some of the manufacturers that we work with are starting to donate goods so that we can pass those savings along to medical professionals. Ultimately, our goal as a business is to cover our costs. We cannot lose money on something like this, just given all of the challenges that we face as a business. But by no means is this a profitable initiative for Sims. We want to deliver really high quality product at a very reasonable price. And anybody who wants to help us reduce those prices, reduce those costs, we would really welcome that partnership.
Wonderful. That's great to hear. Well, I know Facebook's blowing up with comments and questions about Sims, so I'll let Joe maybe hit on a couple of those.
Yeah, absolutely. Thanks, Eric, and thanks, Ben, for joining us today. Just wanted to say, congratulations on the production of these hospital gowns. It's really incredible to see, the ingenuity from your company and many others as they make these pivots in uncertain times. As Eric mentioned, we're getting dozens of thank yous for Sims and the efforts you guys are making on our Facebook Live feed right now. And so, again, it's very much appreciated, and it's really, really cool what you guys are doing. I was just curious, what were some of the challenges that you faced in making this pivot, or was it a natural fit?
One of my initial concerns was our inexperience producing FDA certified medical devices. I was concerned about the compliance side of this. But we pretty quickly determined that we could create gowns that had the functional attributes that medical professionals need, and that hospitals and doctors right now are much less concerned about FDA compliance for this type of product. So we pretty quickly determined that compliance should not be an insurmountable hurdle. It's just something we need to be extremely transparent about with everybody who's involved in this. So the next hurdle after that was just figuring out how to translate our capabilities into a product that we'd never made before, and for which it was really difficult to get samples. Anybody who has gowns right now is really hesitant to give them up so that we could go through and kind of break them down and figure out how to reverse engineer and rebuild. But we have a super talented team, Katie Taylor, Clay Kroll, Robert Gibson. These are folks that are apparel designers and fit experts and manufacturing experts. And they got really excited about this problem, and it was all hands on deck for several days until we delivered a prototype to Bozeman Deaconess. Went through a couple of rounds of iteration with them, and ultimately landed on a product that seems to work. So that's where we're going, building off of that sort of initial proof of concept.
Got it. Oh, that's amazing. Well, I was curious, what kind of production numbers are you guys able to produce? At this stage?
Yeah, we're somewhat limited by a couple of factors. So one is that these gowns are 100% sewing, whereas a waiter has a lot of pressing and other types of manufacturing in terms of like making the stocking feet. So we don't have the ability to bring all of our workers back because not all of our workers are sewing specific experts. So that's one constraint. The other constraint is we just need to keep people distant within the manufacturing environment to ensure that everybody's safe. And so as we spread machines and folks out throughout our facility, we're just limited in terms of the number of people that can be there. Having said that, we expect that we'll produce about 1,000 gowns this week, roughly 1,500 gowns next week, ramping up to 2,000 gowns per week for the foreseeable future. And certainly seeking ways to go above and beyond that. But right now, we think we can get to 2,000 gowns per week.
That's incredible. That is really impressive stuff, Ben. Thank you so much. Really appreciate you guys, what you're doing, and thanks for joining us.
Yeah, thank you for having me.
Ben, I did get one last question in. Can fish catch COVID?
I heard that a tiger in New York got COVID. That was just on the news. So, I mean, I'm no expert, but fingers crossed. They're socially distant underwater. Hopefully that helps.
Yeah, no, absolutely. Well, thank you once again. I'm a fan for life. So go Sims.
Yeah, thank you.